Why do some HPV infections clear on their own? Imagine catching a cold that just goes away without needing medicine. Human papillomavirus infections often do the same. Most clear up naturally because of how our immune system and body cells work together. When someone gets infected with HPV, especially if their immune system is healthy, their body can often fight off the virus within 1 to 2 years. This means the infection disappears without causing symptoms or leading to serious health issues. The main reason is our immune system's response. Our immune system has specialized cells called T lymphocytes that can recognize and attack HPV-infected cells. These cells help clear the infection by destroying the cells that harbor the virus. A strong immune response can prevent the virus from sticking around and causing problems like warts or abnormal cell changes. However, HPV has evolved ways to hide from immune detection. For example, some of the virus's proteins can interfere with immune signaling, making it harder for the body to recognize the infection. Despite this, many people's immune systems still manage to mount an effective attack and clear the virus. Another factor is what scientists call stochastic cellular dynamics. This means that random processes in our body can help eliminate HPV. The cells in the skin and mucous membranes are constantly dividing and shedding. Sometimes, infected cells are naturally lost when new cells grow or when infected cells die off through normal cell turnover. This random loss can remove the infected cells without the immune system needing to do much. Studies suggest that in young, healthy people, this process plays a big role in clearing HPV, with immune responses contributing less than 20%. The chance of clearing an HPV infection also depends on the type of virus and the person's overall health. Low-risk HPV types, which are less likely to cause cancer, tend to clear faster. High-risk types like HPV-16 are more persistent and can sometimes lead to cervical or other reproductive cancers if they stay in the body for a long time. Factors like having antibodies against HPV or a healthy vaginal microbiome can help the body fight off the virus. On the other hand, immune suppression or other infections can make it harder for the body to clear HPV, leading to longer-lasting infections. Lastly, HPV manipulates the way cells die and grow. It can influence programmed cell death or apoptosis to keep infected cells alive longer, which benefits the virus. When the immune system or natural cell turnover disrupts this balance, the virus can be eliminated. Understanding why some HPV infections clear naturally is especially important in the context of cervical and reproductive cancers. Persistent infections with high-risk HPV types are the main cause of precancerous changes and cervical cancer. The fact that most infections resolve on their own explains why only a small number progress to serious disease. This highlights the importance of regular screening and follow-up, so persistent infections can be caught early and managed properly. In summary, the natural clearance of HPV involves a complex dance between the immune system, random cell processes, the type of virus, and individual health factors. This remarkable ability of the body to control and eliminate many infections is why most people do not develop HPV-related cancers. Still, it's always best to consult healthcare professionals for personalized advice and appropriate screening to stay protected.